So today we will be talking all about our horse's bit and bridle fit, and I'm delighted to be joined by two of our industry experts, Catherine Baker and Dr. Chris Pearce. Catherine Baker is the Vice President of the Society of Master Saddlers and is a Master Saddler and Master Bridle Maker, as well as an SMS registered qualified saddle fitter and bridle fitter. She's also a LANTRA accredited bit and bridle fitting consultant. Catherine is passionate about horses and their welfare and prides herself on looking at the horse and rider combination whilst working with other equine professionals to maximise horse welfare and performance. Catherine also is a course leader for the Society's City and Guilds bridle fitting qualification and lectures to equestrian bodies worldwide. Dr. Chris Pearce is the director and founder of the Equine Dental Clinic, the largest specialist referral veterinary practice dedicated to equine dentistry in the world. Chris has considerable experience in equine dentistry at all levels and was the first vet in the UK to qualify as an equine dental technician in 2001. Chris is passionate about education and teaches worldwide, currently joining us from Kenya. Chris and the team at the Equine Dental Clinic have partnered with the British Horse Society to create our dental campaign, No Pain, Check Again, which aims to raise awareness on the benefits of regular dental checks and signs of dental problems. So Catherine and Chris, thank you so much for joining us today. It's really appreciated. And I think really to begin our initial discussion is really looking at why is it so important to have a correctly fitted bit for our horse in terms of welfare and performance.
Okay, do you want me to start with that one? So it's really important to have a correctly fitted bit and bridle actually for our horses. Our horses don't ask to be ridden, and man came along and decided that they were great for riding and for using for work. And to communicate with our horses, to be able to kind of guide them, steer them which way we want to go, we need to have some method of doing that. And one of the methods of doing that is obviously by using a bit. If we're putting a bit into a horse's mouth, then we need to make sure that that horse is as comfortable as it can be in its work.
Yes. And I think the bit is the okay, it's not the single point of contact. We know there are a number of points of contact, but it's a real primary point of contact, and it has been for thousands of years. And if anybody thinks that the bit can't exert excessive pressure and cause injury and disease, and not so much disease, but can cause injury and trauma and pain, then they're very much mistaken. And it's been like that for many years. And I think now, especially as we've got much more of a spotlight, quite rightly, on animal welfare and horse welfare, especially horses in competition, and there's a lot more sort of critique of the way that horses are used as sort of pleasure animals. And I think for all those reasons, we have to be so careful that we, our number one sort of focus is on making sure that the welfare of the horse is properly looked after. And we'll talk about this as we go through, but we see bitting injuries all the time. And just an interesting point, people actually age horses by, or they in historical terms, they look at the wear of teeth by the bit to try and age when horses were first ridden by man, going back thousands of years. And so what they're looking at is a sort of a detrimental effect on the horse that the bit had in the mouth all those years ago. And we still see those same injuries happening now. So, I think it's just so important that we try and educate people. It's great. This campaign is so good, raising awareness of it. And I think as we go through, we'll try and encourage owners to sort of check their own horses' mouths more carefully themselves, as well as bringing them in for dental checks and things, or having their mouths checked at dental appointments.
Absolutely. And I think, sorry, Gary, I was just going to add, I think it kind of follows on that if your horse is comfortable in the mouth, then it's going to enhance the performance of the horse as well. And when you think about all the connections that we have from the horse's mouth throughout the whole of the horse's body, then it's important that your horse is comfortable and happy in his work.
Yes, and I think look, we'll talk about the correct way that a bit should be fitted, perhaps, and discuss that. But the other thing that everybody has to remember is that because often that is the point of contact, if there are any resistances, then yes, the first point that you might want to look at is the bit. But we have to remember that there are so many other causes of ridden resistances. And we mustn't just think, oh, it must be the bit if the horse is resisting in contact and showing some of these signs. And I'll come back to that later and talk about this ridden horse pain ethogram that Sue Dyson has been developing, that shows that there are a number of factors which can affect the way that horse goes. And it may be that it sort of translates to what might look like a bitting injury or a bitting problem. And because the horse is then becoming more difficult to ride, people might start to use a stronger rein tension and end up causing bitting injuries. And we need to assess that, and we need to look at that. And then we have to look at the horse in the whole and in the round and see not only have we got the correct bit for the horse, but are there any other reasons why there might be ridden resistances causing those bitting problems?
Yeah, absolutely. I think that's really key. And I mean, you just touched on it, Chris, in the sense of looking at we have the right bit for the horse. And I know as a horse owner myself, there's so many options of bits for horse owners to choose from that are out there. So, Catherine, what kind of top tips would you give to horse owners that are trying to choose the right bit for their horse? Is there like any considerations that when you kind of speak to clients, what should they be looking at when making that decision?
Yeah, okay. So one of the first things that I do actually when I talk to clients, they ring me up and they say, oh, can you come and help with bit or bridle? And saddle fit as well. I'm a saddle fitter too, so I get asked for all sorts of things, covering all bases. I always ask for full details of the horse, not just name, age, etc., but also the breed of the horse. What work are they doing? What discipline are they doing? What level are they what level are they working to? So not necessarily competing at, because not everybody competes, but what level is the horse educated to, but also what level is the rider educated to as well. Because of course it's all well and good bitting to fit the horse, but if the rider hasn't got the knowledge or the experience or the understanding of that bit or how it works and how to use it correctly, then you might be bitting incorrectly. I mean, obviously then there's mouth conformation as well that we need to look at, and I'm sure Chris will go into that a little bit more as well. Are there any asymmetries, any abnormalities? We've briefly touched on injuries, and I know Chris will go into more of that because he sees an awful lot of those, as do I. But then also, what are you trying to achieve from bitting? Are you trying to work through a schooling issue that your horse has got, or is your horse just showing signs of discomfort, and you want to make it more comfortable? I think so. Going on from there, then, if these are questions that people are asking themselves, then obviously they need to get in. They need to use a bit fitter, somebody who's got a good knowledge of how bits work, and who's experienced in fitting bits as well, and get those type of people to help you. They need to have a good range of bits so that they can, they've got something that is going to be suitable for your horse. Because I think one thing that a lot of people forget is that horses are individuals, much like we're all individuals as well. I often use a chocolate bar analogy with some of the candidates that I lecture to. We're all normally all women, to be fair. There are a few men, but we're all normally stood there. We all like chocolate, but we all like different chocolate bars. And it's the same with horses. We all use bits on maybe the same types of horses, but it doesn't necessarily mean that they're going to like the same type of bit that we're putting into their mouth.
I think I like all chocolate bars, to be fair. No, I know what you mean, and I think there's that's something actually I didn't appreciate until, well, it's probably a number of years ago now, but I remember when I was learning more about bitting, I didn't understand this concept of metal having a taste. And of course, we sort of all know that, if your silver spoon tastes a lot nicer than tastes a lot more neutral than some other metals. And of course, some of these bits designed to have a specific kind of taste. And some horses will like that, and some won't. Some it will stimulate more salivation, and others it won't. And I've found over the years that like you say, it's incredibly individual. And for that reason, I do sometimes find it very hard to make specific recommendations for a specific bit. And I'm not a Loriner. I have a basic working knowledge of bits and know that, the different types. But of course, increasingly with the companies that are making bits, and they're all, of course, manufacturing a new one with a slightly different angled central lozenge to try and corner the market. And so, we've got to sort of look through that and try and look at sort of trends in bit design and what kind of bit is better and what kind of bit might not be so good. And of course, like you say, discipline comes into it. If you're riding high level dressage and you have to compete in a double, but of course that's completely different. And these lever bits, they're certainly capable of producing the worst injuries. I mean, we see sequestration of bone of the mandible, where so we're talking about the bone in the interdental space between the incisors and the cheek teeth where the bit sits, and the pressure on the bone on the bottom there with a leverage type bit, such as in a double bridle, a pelham, and so on, and some of these Western bits, they can cause so much pressure that it actually kills the bone underneath, and over a period of days or weeks, the bone will splinter and partially come out through the surface. I mean, they're horrific. And so this is, learning to use these bits is at the sort of upper echelon of those disciplines. And that's, as you say, it's so important that people understand the potential for damage with these bits. And, there are people out there, there's a particular vet who's absolutely adamant that no horse should ever be ridden in a bit, and that they're all welfare. And there are some interesting studies to show that, quite a number of horses do show adverse behaviors with a bit. So it's incredibly important to make sure, I think, that you choose a bit that is comfortable for your horse. And if there's an immediate resistance and something's wrong, the answer is not just putting and trying, this, that, and the other. Or it's stopping and getting a professional perhaps to have a look, both at the mouth and also at the bit, and get somebody to come along and try some different bits. And I don't know how you operate, Catherine, but I know, speaking to some other bitting experts and Loriners, they'll often come along with a range of bits to try on a horse to try and find that one that is comfortable.
Just coming back to the different types a little bit, it's, I guess, I don't know with you, Catherine, do you find that you will find horses change the type of bit that they want as you kind of progress through their career or through their life working partnership with them? If you have a client that is someone you'd work with regularly, that you'll find that it's not one bit fits and that's it for the rest of its life. Something will change depending on, and it's really good to be monitoring that continuously.
Yeah, absolutely. I mean, there are some horses out there that will be quite happy in the same bit for the whole of its life. They might be happy, or they might be happy in the same mouthpiece for the whole of its life, but you might want to consider changing the cheeks because, the different cheeks have different actions. So there are horses that are happy with that, but equally there are horses that you will need to kind of go back and revisit again and again, particularly if they're, Chris touched on horses about going up through the levels of riding. So if they're going up through the levels of dressage, then they might progress from, obviously your snaffle bit up to a double bridle, and then you would look at changing bits again then. If they're changing owners, so if a horse has gone from one owner to another owner, it might work really nicely in one bit for its original owner, but if it's been sold to somebody who maybe has a little bit more or a little bit less experience and understanding, then you would need to potentially look at the bit again then, because what's working for that previous person doesn't necessarily work for the next person. And that's not to say that you would then go out and immediately bit up that horse, because I'm with Chris. If anything, I like to kind of try and bit back downwards again, because I find that most of the problems that we have are horses that are overbitted, or riders that don't understand the action of that bit. So if you can put the horse into something more comfortable, bring it back down again, and then advise the owner, look, I've done this for you. You now need to go out and do some homework. You need to go and maybe have some lessons and some, some coaching on how to ride with this bit, or how to ride just in this situation. So yeah, definitely you can be changing horses. And also if you've got a young horse that you might start off in one bit, even if that just naturally it progresses and it goes on to something else and goes on to something else as it gets a little bit further in its education. So again, we're not talking about advanced horses, we're talking horses right at the start of their career. You might start them in one bit, you might then change them to something else 6 months or a year later.
Okay, so Chris, from a dentistry perspective, what are your kind of things you'd be specifically looking at when kind of speaking with an owner who's considering getting a bit for their horse, or what the right bit to choose, especially maybe if they came to you with a youngster who hadn't had a bit before?
Yeah, so there's a number of things that we would look at, both conformation wise, both dental wise and bit wise. And if we're talking a young horse, the first thing, and something people always ask about, is wolf teeth. And wolf teeth are the vestigial first premolar teeth. They're usually pretty small, often about the size of our own canine teeth, so much smaller than the other cheek teeth. And they're positioned just in front of the cheek teeth. And in young horses, they can be fairly weakly attached in the root, and they can become knocked and damaged quite easily by the bit. And so in young horses, we generally do remove wolf teeth, and it has to be done under sedation and local anesthetic. That's really, really important. And once those are out the way, they'll heal within a couple of weeks, and that's fine. Now, in older horses, if we saw a 15-year-old that already had wolf teeth, we wouldn't necessarily recommend extraction of them in every circumstance. So that's very much an individual thing with the horse, but generally in young horses, we'll look for them. We can see blind wolf teeth, as we call them, which are unerupted under the gum. And they can be particularly problematic with the bit, especially if they're on the lower bars of the mouth, the lower jaw between the teeth and the cheek teeth and the incisor teeth. So that's one thing that we would look for and assess. And then we would look at the kind of general conformation of the mouth. And there's a few measurements that we look at. There's quite a bit of variation between the width of the bars of the mouth, which are the sort of two branches of the mandible at the bottom. That can vary quite a lot. And then we measure the sort of height of the space in the mouth. So the distance between the lower jaws and the upper bone of the maxilla. And that can vary a lot. It can be between 20 mil to 45 mil. And so that's the space that the bit's got to fit in. Now, if your horse has only got a 22 millimeter width and you put in a 17 millimeter bit or a 20 millimeter bit, there's not really room for the tongue and the soft tissues and anything else. So that's quite an important measurement for us to take. And it does vary quite a lot. The height of the palate and the type of arch that the horse has there that we would look at, and that might decide whether we're happy for the horse to go in a simple jointed bit or whether something with a lozenge that breaks the profile would be better. And then we look at the teeth. And and of course, we'll always look around and see if we can see any current injuries if the horse is currently bitted. And then we look at the teeth. And there are a number of things with the teeth. We're going to do our full dental examination. We always do everything sedated, and we're always looking with mirrors and cameras in the mouth and looking for any subtle changes, which is all what our health project is about, the no pain check, again, looking for these subtle signs that could be affecting it. They're not so much necessarily relating to the bit, but they can affect performance. So that very, very important to do that. And the nose band as well, on the outside of the upper cheek teeth, will have these sharp points. And if they're too sharp, and if the nose band has been applied too tightly, that can cause quite severe ulcerations of the soft tissues. And then there's the front of the cheek teeth, an area that used to be called the bit seat. Now we've tried to eradicate that word from the dental dictionary or the bitting dictionary, because some people thought it would be a good idea to really aggressively round off the front of the cheek teeth and do what was called installing a bit seat. And the idea was that it would help the bit to seat at that position. Well, the bit doesn't sit there, actually. It sits about 20 millimeters, 30 millimeters further forward. But it can cause some soft tissue injuries if that area is very sharp. But if you rasp it too much, you can go into the blood and nerve channels, the pulp of the tooth, and you can kill the tooth. So we've seen a number of instances where that's happened. And that's when the horses were given these aggressive kind of bit seats. So they're an absolute no-no. But it is appropriate just to make that area not sharp, because there can be some soft tissue injuries that will appear. So that's a kind of a general thing. So we're looking at conformation, wolf teeth. We're looking at the cheek teeth as well, looking for diseases, all sorts of things.
Amazing. And you touched on there briefly around like the noseband. So Catherine, I'm assuming bridle fit is something you really kind of work closely when you look at bit fit, bridle fit. I'm assuming they collaborate really kind of closely together in terms of
Yeah.
the consideration you'd be looking at.
Yeah, so when you said in my introduction, I'm a qualified bridle fitter, but I've also done the Lantra bit and bridle courses as well. So, but I'm also a master bridle maker. So I suppose my passion for bridle fitting, I suppose, and bit fitting kind of came from my passion for creating bridles and making bridles to go onto horses. And it's, there's a few important areas on the horse's head that you kind of have to consider when you're bridle fitting. You also have to consider how the bit is going to affect your bridle as well. And like you say, the nosebands, it's really, really important that you consider the nosebands, and we are, we preach that, certainly within the Society of Master Saddlers, we preach that you should always fit at least 2 fingers on the front of the nasal bone there underneath any noseband that's fitted. I think we kind of, in days gone by, we kind of put nosebands on that came under the jaw, which were used to strap the horse's mouth closed. And actually, that's not the case. That shouldn't be the case. You should always be able to fit 2 fingers under the front of the noseband, and exactly for the reasons that Chris says, because if the noseband's too tight on the cheek teeth, you can cause those nasty injuries on the inside there. And then people, kind of what that leads on to, I think, is that people would then assume that their horse was being naughty or misbehaving, and so they would crank the noseband up tighter. That actually just exacerbates the situation. You need to loosen that noseband off and allow the horse to feel like it can go forward into a contact, and to keep the horse comfortable.
Absolutely. And I mean, between you, I'm sure you've both got cases where you've worked with kind of horses and owners that have unknowingly had these issues. Is there anything you can kind of think of in terms of like core examples of where things have gone wrong as a result of poor bit fit or bridle fit?
The most, if I go in order of severity, I think the most severe that I've seen have been from any kind of leverage bit, either double bridles with a pelham, with Kimberwicks, with sort of combination bits, which are still applying potentially a lot of pressure onto the bars of the mouth. And I think these are the most severe and the most ones likely to affect welfare, because they can cause death of the bone. I think I mentioned that earlier, and the bone will die, form what we call a sequestrum, and it'll actually then kind of try and surface and almost like splinter out of the jaw. And they're horrific. They get very infected. They're very painful. And amazingly, sometimes the only sign, and I'll share a picture with you afterwards, Gabby, that you maybe put in. But this particular case had a really deep sequestrum, very painful bar of the mouth, and it was still being ridden. And the owner was having all sorts of problems on one rein, and there's just a tiny pinhole. And when you squeezed around it, pus came out of that pinhole. And when we x-rayed, this was a pinhole sort of size lesion on the bar of the mouth on the right side. And then when we x-rayed it, that you could see this sort of classic saucer-shaped piece of dead bone under the surface. And the gum is only a few millimeters thick that covers the bone in that region. And the bone gets very easily pressurized. So we've seen that in children's ponies. We've seen that in dressage. We've seen that from driving horses. And they take a long time to heal. They will take 6 to 8 weeks to heal. And sometimes they need proper surgery to actually cut in there and scrape them out. So, but actually, day to day, we see so many commissure injuries. And I'll just refer to a couple of colleagues of mine. There's one called Kati Tuomala in Finland, and her and a group of friends in Finland did a really nice study in 2001 looking at event horses. Now, this was a fairly low-level eventing, and what they did was they examined 200 horses, and it was a voluntary examination after the show jumping phase. 54% of the horses they examined had bitting injuries, ulcerations, bruises, lacerations, and of those, the vast majority of them were the commissure of the lip injuries, sort of bruising and cuts. And I see that exactly reflected in our practice.
Reflective of what you see, Catherine, in terms of those like Chris is saying, he sees quite commonly like the bruising in the mouth and things. Is that
Yeah,
reflective of what you're seeing?
absolutely. So the bruising in the mouth and sometimes on the tongue is the most common injury that I see as a bit fitter. So when I go out and I do my assessment, I do a head assessment, and I do a mouth assessment as well. Obviously not the same mouth assessment that Chris is going to do, because he has the advantage of being able to put a gag on and have a really good look in the horse's mouth. I don't. But when we do a head assessment, we run our hands over the poll, down behind the ears. We're applying a little bit of pressure. We're seeing if there's any kind of reaction there from the horse, if there's any tension from the horse around the TMJ, which is effectively the jaw joint. And then we come down around the side of the face, the facial crest. There's a lot of nerves and blood vessels that run up beneath the facial crest. So we spoke about earlier, nosebands being too tight. That's why we don't have nosebands rammed right up underneath the facial crest. And often I find that, so this isn't necessarily a bitting injury, but I find that if people have their nosebands too high, one of the things I ask them is, does your horse rub its nose when you get off? And they go, oh yeah, like that. And I find that that's quite common. The noseband's too high, and I assume that what's happening is they're probably cutting off the blood supply there somewhere, or affecting the nerves there somewhere, and the horse is trying to get feeling and sensation back maybe into its nose when you take the bridle off. The bitting injuries that I see is, yes, often I see the bruising on the inside of the lips and the commissures. They're not always necessarily, some people think you just have a look in the horse's mouth and it's going to be obvious. They're not. Sometimes you have to kind of really turn the lip inside out to be able to have a look down the inside. And I think one of the biggest causes of those, or the bit that's probably the most responsible for most of those injuries, actually are loose ring bits. Lots of people like loose ring snaffles because they're good for horses that lean on your hand a little bit or a little bit heavy on the forehand. But I think that movement there can cause that pinching, as well as it can cause pinching on the outside of the mouth as well.
So you've both spoken quite a lot about kind of physical things that you've kind of picked up on, or horse owners have picked up on as a result of a poorly fitted bit. But are there any signs that maybe horse owners could look out for that might indicate their horse isn't comfortable in the mouth, or their bit doesn't fit, which is kind of before you'd see those kind of physical injuries, I guess? Is there anything more behaviourally that they might pick up on?
So you would see, so a lot of people see behavioural issues, and that might be something as simple as a horse being resistant on one rein, or difficulty striking off on a particular canter lead, for example. You might get some head tossing. You might get the horse putting its head up in the air or coming behind the contact. All of these are kind of classed as behavioural issues, I suppose, and they're the lower end of the scale, I suppose. And then it goes right the way up through to the really unwanted behaviours that you might see, which is a horse completely refusing to go forwards, napping, rearing, spinning, all of that kind of stuff as well, and maybe bucking. And of course, you don't want any of that to happen. I think if you see any of those issues, then you've got to ask yourself a question: why is this happening? Okay, what has changed recently? Is there anything that has changed recently? And then I think from there you make an educated decision as to who do you call first to help you with this decision. Is there anybody you can call to help you with this decision is probably the first thing. And who do you call first? If it's if you think it's a mild scalding issue, for example, then I would probably suggest calling your bit fitter out first, and working through that with you. And often, one of the very first questions that I ask is, when did your horse last have its teeth done? When did you last see an equine dentist? And then I follow it up with, and I'm sure Chris will be pleased to hear this, was it sedated when it had its teeth done? Okay, because often, I'm sure Chris will go into more detail that without the sedation, then they can't necessarily do everything that they might need to do. There might be some simple things there that they can't see, but that might be causing the horse discomfort in the mouth. So generally, if it's a what we call a lower level sign of discomfort, but you might see things as well, like just the ears, the facial expression, the horse is just generally unhappy. Of course, that doesn't necessarily mean that it is a bitting issue. It could be a bitting issue, it could be a bridling issue, it could be a saddle fitting issue, it could be any other issues, anything else that could cause those issues. The horse could be in pain somewhere else as well. But yes, if you think that it is bitting or bridle related, then certainly call your bit fitter, and then hopefully your bit fitter, if you haven't seen a dentist recently, or if they suspect there's something going on in the mouth, they will refer you to your equine dentist.
Yeah,
All
excellent. And
Yeah.
just before we go to you, Chris, because I'm sure you've got loads you can feed into that. But if a horse owner, Catherine, was thinking they'd like to get a bit or bridle fitter out, and maybe it's not something they've done before, where would they go to kind of find someone local to them? Where would be the best kind of starting point for them, I guess?
Okay, so at the Society of Master Saddlers, then we have qualified bridle fitters all around the country. It's a relatively new qualification. It came out in 2019. It's a City and Guilds qualification. Obviously the first group to be qualified were literally November 2019, and then we went into the pandemic and COVID. So that put a little bit of a spanner in the works as to pushing, kind of getting people through the course and the qualification. And you can find them on the Society of Master Saddlers website, which is www.mastersaddlers.co.uk. And there's lots of drop-down menus in there, and you can select, qualified bridle fitter, and they should be able to come out and help you with that.
Amazing. So Chris, on to you, I guess, in terms of signs that you would be more kind of getting horse owners to be a bit more conscious of and thinking about if they're recognizing them in their horses.
Yeah, so I think Catherine summarized it very well. It can be anything from tail swishing to being very solid or wooden on one particular rein. Not all horses respond to pain in the same way. Some of them will just sort of set themselves tight and then put up with the pain while they're being ridden. And so any difference from one rein to the other, any other kind of behavioural or conflict behaviour, and as I say, Catherine went through those very well, and I would fully, completely agree with all of those. Thing I would point out, just sort of almost mentioned it then, is that the whole purpose of our dental campaign with the BHS No Pain Check Again is that so many horses will put up with these things, and especially it seems at the higher levels, because those horses are so well schooled, and it seems that they will tolerate a lot in their sort of daily work, and all horses will do this. They're stoic by nature. They want to sort of please. They want to do the right thing, and they respond to the aids in the best way that they can. And some of them will just put up with it, and there will not be any signs at all. So just because the horse is not doing any of those adverse kind of conflict behaviors doesn't mean that there's not likely to be a bitting problem. And I would say actually the vast majority that we see when horses come in for, okay, I do a number of these types of poor performance, abnormal behavioral consultations, but the vast majority of the cases that I'm seeing are for dental reasons and will pick up bitting injuries at the same time. And owners are often very unaware that their horses have got a bitting injury. But when you drill down into it, when you start asking questions, then you'll find, oh, well, actually, yes, he doesn't like going on this rein, or he doesn't like doing this particular maneuver or whatever. And you think, well, okay, well, this is because there is this injury and it's getting worse.
I mean, from this discussion, we've really highlighted how complex it really is in terms of the whole kind of together of what we've been talking about around the horse's mouth and beyond, really. But as a final point, is there anything, if there's a short piece of information you could kind of get the horse owners to take away from this discussion, what would it be for both of you, and just that you really want them to hone in on?
Oh, I think for me, it would be listen to what your horse is trying to tell you.
Yeah.
So, just really kind of, if your horse is doing anything different or anything untoward, or even if it's not, even if you are struggling with, schooling or something like that, listen to what your horse is trying to tell you. Is it trying to tell you something? And if it is, try and figure out what that is and what professional you need to call to give you some help.
Yeah, definitely. Chris?
Yeah, I think I would say that owners should just get in the habit of examining the corners of the lips, and as Catherine said, just turning them inside out, and just checking that after every ride, or certainly after every, certainly periodically, maybe once or twice a week. because they are so common, those injuries, and they might just be signaling that something's wrong, and it's just easier to nip it in the bud at that stage. And then I would say this because I'm a dental specialist, but I would say that, you know, every horse really has to have a 6-monthly or 9-monthly proper examination where the whole of the mouth gets inspected. You know, it's not a quick look in the dark and a quick feel around. I think that mouth needs inspecting, and we need to be studying and looking for these sort of more subtle signs and changes of disease, not just with the bit, but everywhere. But we will discuss that more in our dental campaign.
Yeah, definitely. Well, thank you both so much for your time and contributions to such a valuable conversation. For anyone listening who would like more information on TacFit, we have a series of fantastic blogs supported by the Society of Master Saddlers that can be found on our website at bhs.org.uk. Thank you both so much. It's been fantastic.
Thank you.
Thank you very much. Pleasure. Good. Great.